6:20 now, and as we've been reporting this morning, use of the Johnson & Johnson vaccine is right now on pause because of blood clot concerns in a handful of women.
Well, joining us now live is Philadelphia Health Commissioner Dr. Thomas Farley. Good morning, doctor.
Good morning.
So can you tell us, first of all, about how this temporary hold is going to be impacting vaccinations in the city?
Well, it's not going to have a huge impact. We were able to quickly switch to using the Pfizer vaccine and the Moderna vaccine at the public sites that we're involved in, and also the healthcare providers around the city are able to switch. And so it does mean that some people who were going to have a one-shot vaccine will switch to a two-shot vaccine, but most clinics are going to continue to operate.
All right, so as we've been saying, a handful of women had this negative response to the J&J vaccine, but 6.8 million doses have been administered in the U.S. So for the people who have already gotten that vaccine, should they be concerned, and what do they need to know?
They shouldn't be concerned. This has happened, again, 1 in a million people who got vaccinated. It generally happened in the first 2 weeks after the vaccine. So most people who've got the Johnson & Johnson vaccine are past that window. And also, just to point out that it's much more likely for people to have a complication from the infection than the vaccine. So people really shouldn't be worried about the vaccine. They should be worried more about the epidemic and protecting themselves from that.
Well, obviously, Philadelphia is set to open up eligibility to residents 16 and older starting Monday. Is this going to impact that timeline in any way?
No, it isn't. Everybody who's an adult over 16 should be eligible on Monday. And people can start scheduling now. If you're eager to get vaccinated, then I hope you are eager to get vaccinated.
All right. So also, Dr. Farley, the CDC is holding that emergency meeting today to discuss the J&J vaccines. Tell us what they're going to be looking at, and how soon do you think these vaccinations could resume? When will people start getting those shots in the arm with the J&J vaccine again?
Well, they're going to probably first see if there are any more cases out there that have yet to come to light, and with this information I expect that there may be a couple more. And then they'll look to see whether there's a common pattern here. This looks like this was maybe related to the vaccine, or it was just a random occurrence. On 1 in a million, it could be that. The CDC people have said that they may be able to restart the vaccine use in a matter of days. We don't know. We're going to follow their recommendations, though.
When the J&J vaccine first came out, everyone was thinking, boy, this is great because we need an additional supply coming in here. What about the Pfizer and Moderna supplies? If this becomes a lengthy pause for J&J, is that going to be a problem?
We've been told by the federal government that they're going to get enough additional doses of the Pfizer and the Moderna vaccine. We still ought to be able to meet our targets, and making it eligible for everyone on Monday, and being able to offer to everyone by the end of June.
That's good.
All right. And, as we've been discussing, there has been hesitancy with getting the vaccine. And with this announcement, with this pause with the J&J vaccine, you'd have to imagine that more people may be reluctant because of this pause in the distribution of that vaccine. What's your message to them, to those who are nervous about getting the shots?
Well, first, as we point out, this complication, if it is a complication, the Johnson & Johnson is extremely rare. It's like the likelihood of getting killed by being struck by lightning. And then also, the other vaccines that are available are very fundamentally different technology. Now, 190 million doses of the Pfizer and Moderna vaccine, not seen this complication. So those are extraordinarily safe. So just get vaccinated with one of the other vaccines if you're concerned.
Thank you, Dr. Farley. We appreciate you taking the time. Great advice.